Hello everyone. Welcome back to my YouTube channel. Today, we are going to talk about a global health challenge which is none other than dengue. First, let's unravel what dengue is. Dengue is a viral infection that affects millions of people around the world every year. It is transmitted by mosquitoes that carry the dengue virus, DNV, which belongs to the genus Flavivirus. There are 4 types of DNV, named DNV1, DNV2, DNV3, and DNV4, and each type can cause dengue fever, a disease characterized by high fever, headache, muscle and joint pain, rash, nausea, and vomiting. In some cases, dengue fever can progress to severe dengue, also known as dengue hemorrhagic fever or dengue shock syndrome, which can cause serious bleeding, organ failure, shock, and death. Dengue is endemic in more than 100 countries, mainly in tropical and subtropical regions of the world, where the climate and the environment are favorable for the breeding of the mosquitoes that transmit the virus. The main vector of dengue is the Aedes aegypti mosquito, which is also responsible for the transmission of other diseases, such as yellow fever, Zika, and chikungunya. The Aedes aegypti mosquito is an urban and domestic mosquito, which prefers to bite humans during the day, especially in the early morning and late afternoon. The mosquito can become infected with DNV when it bites a person who has the virus in their blood, and then transmit the virus to another person when it bites them. The mosquito remains infected for its entire lifespan, which can be up to a month. The incidence and geographic distribution of dengue have increased dramatically in the past decades, due to several factors, such as population growth, urbanization, globalization, climate change, and lack of effective vector control. According to the World Health Organization, WHO, about half of the world's population is now at risk of dengue, with an estimated 100 to 400 million infections occurring each year. Dengue is the most rapidly spreading mosquito-borne viral disease in the world, and it is a major public health problem in many countries, especially in Asia, Latin America, and Africa. Dengue causes a significant burden of morbidity, mortality, and economic loss, and it poses a threat to international travel and trade. Afterwards, I am going to make you aware of the treatments. The diagnosis and treatment of dengue are challenging, as there is no specific test or drug for the disease. The diagnosis of dengue is based on clinical signs and symptoms, epidemiological history, and laboratory tests. The laboratory tests include the detection of the virus, its genetic material, or its antigens in the blood or other body fluids, or the detection of the antibodies produced by the immune system in response to the infection. However, these tests have limitations, such as low sensitivity, specificity, availability, or affordability, and they may not be able to distinguish between the different types of DNV or between dengue and other similar diseases. The treatment of dengue is mainly supportive and symptomatic, and it depends on the severity of the disease. The main goal of treatment is to prevent dehydration, control fever and pain, and monitor for signs of complications. For mild cases of dengue fever, the treatment consists of oral rehydration, rest, and analgesics, such as acetaminophen, paracetamol, which can reduce fever and pain. Aspirin and nonsteroidal anti-inflammatory drugs, NSAIDs, such as ibuprofen, should be avoided, as they can increase the risk of bleeding and worsen the disease. For severe cases of dengue, the treatment requires hospitalization and intensive care, and it may include intravenous fluids, blood transfusion, oxygen therapy, and antibiotics for secondary infections. Moreover, let's discuss how to avoid this deadly disease. The prevention and control of dengue depend on the reduction of the mosquito population and the protection of people from mosquito bites. The reduction of the mosquito population can be achieved by eliminating or treating the potential breeding sites, such as containers with water, trash, and tires, where the mosquitoes lay their eggs. This can be done by draining, covering, or cleaning the containers, or by applying larvicides, insecticides, or biological agents, such as fish or bacteria, that can kill the mosquito larvae. The protection of people from mosquito bites can be achieved by using personal and household measures, such as wearing long-sleeved clothing, using insect repellents, sleeping under mosquito nets, and installing screens on windows and doors. There is also a vaccine for dengue, called Dengvaxia, which was developed by Sanofi Pasteur and approved by the WHO in 2016. The vaccine is a live attenuated tetravalent vaccine, which means that it contains weakened versions of the 4 types of DNV, and it can induce an immune response against all of them. The vaccine is administered in 3 doses, with an interval of 6 months between each dose, and it is recommended for people aged 9 to 45 years who live in areas where dengue is endemic and who have had a previous dengue infection. The vaccine is not recommended for people who have never had dengue, as it may increase the risk of severe dengue if they get infected after vaccination. The vaccine is also not recommended for pregnant or breastfeeding women, people with weakened immune systems, or people with severe allergic reactions to any component of the vaccine. The vaccine is effective in reducing the incidence and severity of dengue, but it is not a substitute for vector control and personal protection. Dengue is a global health challenge that requires a coordinated and integrated approach from all stakeholders, including governments, health authorities, researchers, health workers, communities, and individuals. The WHO has developed a global strategy for dengue prevention and control, which aims to reduce the mortality and morbidity of dengue by 50% and 25%, respectively, by 2020. The strategy focuses on 5 key objectives: strengthening surveillance and outbreak response, improving case management and clinical care, promoting integrated vector management, fostering research and innovation, and enhancing community engagement and empowerment. Dengue is a serious and potentially life-threatening disease that affects millions of people every year. By being aware of the symptoms, causes, complications, and prevention methods of dengue, we can protect ourselves and our loved ones from this dangerous disease. Finally, we have come to the end of the video. So don't forget to subscribe to my